I'm Dr. Elizabeth Comen. Here are 5 things I never learned in med school about women's health. Number 1, women are not small men. That sounds almost ridiculous and obvious to say, but it wasn't at all during my medical school training. Almost everything I learned about in medical school was based on the 70-kilogram white reference male. So what did that mean? Everything from drug metabolism, something we call pharmacokinetics, to how women and men may present differently with disease, to how we image different diseases in the body, to even the basic EKG for how we determine if someone's having a heart attack. For example, when I was taught in medical school that women present with atypical chest pain for their heart attack symptoms. But why would it be atypical if we're 51% of the population and heart disease is the #1 killer of women? So throughout every stage of my training, every disease was based on the reference male, with women's presentation being the atypical version of that. Number 2, women's health is not just bikini medicine. Now, what do I mean by bikini medicine? I mean their breast health and their reproductive health. You would think in my medical school training that encompassed all of women's health, but we know that's not the case. But yet in my anatomy class, for example, if I were to learn about the lungs or the heart or the GI system, it would be on a male skeletal form. Never was I presented how these diseases might look different in the female form. Now, what's really kind of ironic about the fact that women's health seems to be so focused on bikini medicine is that you would think that would also include their sexual health. But never once can I recall anyone ever talking about women's unique sexual health concerns, unless it were about sexually transmitted diseases, which can affect a man, or pregnancy and the risk of pregnancy. Number 3, I never learned that women's healthcare needs and concerns can evolve and change as they age. So much of what I learned about in medical school about women's health was about puberty or their reproductive fitness. It's as if all these other healthcare concerns and risks and diseases that can affect their whole body were ghosts in our medical school system. For example, I never learned about menopause, period. I also learned about Alzheimer's disease, but I had no idea just how significantly and predominantly women were at risk for this as they age. Number 4, I never learned about women's specific exercise and nutritional needs throughout their whole lifetime. One of the things that was so stressed in medical school was body mass index, which, if you don't know, is a completely bogus measurement of your body size and weight. And so much of the focus was on women being thin. And we know now that it's not about being small, it's about being strong. And I wish I had learned so much more about how to coach women, about muscular strength, and that lifting weights is not about becoming bulky, but actually has really important healthcare consequences for protecting your bones, for protecting your muscles, and helping you stay fit and limber and flexible as you age. Number 5, I had no idea that up until 1993, medicine didn't require that women be included in key clinical trials. So what did that mean? Some of the most important medications that we use today, like aspirin or cholesterol drugs, the landmark trials were done in men and not women at all. And so what did that mean? We baked into the system the idea that, well, whatever we give for men is good enough for women. And even today, we're still playing catch up. We are so far behind in gender parity in medicine.